Hello everyone. Today we will present about topic diagnosis of coronavirus in future. Our presentation has 5 parts: background, direct diagnostic method, indirect diagnostic method, and imaging method, and the future suggestion of diagnostic coronavirus in future. So COVID-19 is acute respiratory syndrome with newly discovered coronavirus. It started from Wuhan, then separated very fast to become a global pandemic with more than 8 million cases and 400,000 deaths. So what reason make COVID separate extremely fast and last for a long time? The first one is ability to pass easily from person to person, from respiratory system. And second one is wide range of symptoms and similar to a common flu like fever or chills, cough, shortness or difficulty of breathing. So it will be hard for clinical diagnosis. And third one is laboratory diagnosis take a long time to detect. So we cannot early quarantine infected people. And a lack of coordination between clinical and laboratory diagnosis is one of the reasons. It will lead to lower test sensitive. As the most important reason is the subjectivity of people and government in early stages of pandemic. So in this topic, we will focus on describe 3 types of tests and propose solution for future diagnosis.
There are 3 types of coronavirus infected disease diagnosis methods, such as direct or indirect method and medical imaging. Direct diagnosis method is a method that identifying coronavirus presence in patient's respiratory tract by finding out coronavirus protein or genome. Real-time polymerase chain reaction is a kind of direct method. Doctors collect a specimen from patient nasal tract and amplify viral genome. If RT-PCR show low CT value, meaning that a threshold cycling value, then we can diagnose that virus is there. RT-PCR can diagnose a symptomatic patient with coronavirus and highly sensitive and specific. However, still small ratio of false negative remains. Antigen test is also a direct method. It is using a virus protein, specific antibody from other animals. If antibody binds to respiratory tract specimen of viral protein, then we can diagnose that coronavirus is infected. However, it is not an effective method to diagnose COVID. Indirect diagnosis is based on antibody production after virus infection. Several days after infection, IgM antibody is produced, and next IgG antibody is produced, and IgG antibody is participating in memory response. From patient serum, we can isolate antibodies and can use in this antibody test. So there are 4 possible antibody test results, either IgM, IgG positive, or both negative. These 2 IgM positive cases means that virus is infected in days before. And only IgG positive means that virus was infected long ago, and currently there is no virus. And these both negative cases means that virus has been not infected. When we use antibody test to diagnose COVID, we should be careful because all patient antibodies have not same epitope recognition, and other coronavirus as like SARS and MERS specific antibodies can be detected. Also, antibody test cannot detect early infection.
COVID imaging features. During the COVID-19 infection, most patients will develop symptoms such as fever, cough, shortness of breath, dyspnea, and myalgia. 17 to 29% of the patients have acute distress syndrome. When chest X-ray is performed, the most common feature is the ground glass opacity, as seen on the film. But X-rays cannot diagnose COVID-19 fully because it is not very sensitive to COVID-19. These 2 films are a result from 1 patient. The left side is an X-ray, the right side is a computer tomography. From here, we can see that when CT is compared to the X-ray, the CT shows a more clear picture of the disease infected area. During the COVID-19 infection, the most common features that are seen on the CT examination are ground glass opacity, consolidation, and the crazy foaming pattern. The first feature during CT examination is the ground glass opacity. It's a GGO sign. This feature is radiological term, which is indicating an area of hazy, increased lung opacity through which vessels and the bronchial structures may still be seen. Another feature during CT for COVID-19 infection is the crazy foaming pattern. This feature is explained by the swelling of a lung interstitial space. When there is a severe infection of COVID-19, the imaging shows a wide area of infection sites throughout the lung. You can compare the film to the previous image. When the patient is infected by COVID-19, the infection sites are usually multiple lobes, both lungs or periphery. So also, because of the difference in infection stage, the CT appearance also shows different results. In minor infection, only one lobe can be infected. Even though CT can be sensitive to COVID-19 infection, we still can't rule out the similar findings of CT features of other virus infection, such as virus pneumonia, adenovirus, or even hemophilia influenza. As a study published in February this year showed from 53 patients, 51 were diagnosed with positive COVID-19 with a correlation to the CT features mentioned above. However, 2 patients were infected with adenovirus but had similar CT results to the COVID-19. Even though the CT is sensitive to COVID, but CT is still limited for identifying specific viruses and the distinguishing between viruses. So, to diagnose the disease, further laboratory tests and the other evaluations should be required to fully diagnose the disease.
So, to summarize, we propose some solutions to improve coronavirus diagnosis in future. The first one, we must to control epidemic area effectively so that we can localize the disease and reduce the number of the tests need to do. And the second one, we must to improve the coordination between clinical and laboratory diagnosis. So better clinical diagnosis will lead to better sample for laboratory tests and better and more reliable diagnosis and early quarantine. And the last one, we must increase the research and project about COVID diagnosis method. PCR, molecular diagnosis, has an important role to improve the diagnosis of COVID in the future. And the CT has a high sensitivity for detecting, so it will helpful to early recognize suspicious case. So thanks for the listening.